Acupuncture has been used for more than 2,000 years to help improve fertility and improve health. Today, 1 in 4 couples are struggling to conceive, and acupuncture has gained new recognition in increasing success rates in IVF. So who comes for fertility acupuncture? Every case is different. I see young women who have irregular periods, or perhaps they have no periods at all because they have polycystic ovary syndrome, and they recognise that this is going to affect their future fertility, so they want to get it treated and sorted now. At the other extreme, I might see somebody, a woman in her early 40s, who's really feeling that she's at the end of her fertile life and is just pulling out all the stops and having her very last round of IVF. And I see lots of people in between. I also see women who have severe period pain or maybe severe premenstrual problems, because these are both signs of fertility issues that need to be addressed. With fertility issues, around 1/3 of cases are female related. Around 1/3 of cases are related to the male, so there might be sperm issues. But in 1/3 of cases, all the fertility tests come back as completely normal, and the reason for your difficulties in conceiving are unexplained, and you may be given a label as being, having unexplained infertility. Try not to worry too much about that, because actually if there's no clear underlying condition, the chances are that you're actually subfertile and not infertile, and actually your fertility issues may be related to lifestyle factors and other issues that can actually, with a bit of effort, be resolved. There's an increasing body of research in acupuncture relating to fertility, and acupuncture can help in a number of different ways. Acupuncture helps regulate hormone levels in both men and women. Acupuncture can help improve sperm quality and egg quality and production. Acupuncture, very importantly, increases blood circulation to the pelvis and to the reproductive organs. Acupuncture can also help with embryo implantation, which is one of the reasons it's why really important in IVF. Acupuncture can also help patients, women suffering from polycystic ovaries, as it seems to help you physiologically. And beyond all of that, acupuncture is marvellous for dealing with stress and anxiety. And if you're watching this video, I suspect that stress and anxiety are probably quite high up on your agenda. So when should you start fertility acupuncture? Ideally, it's a good idea to start a couple of months before you're trying to conceive. One of the most important things that we're trying to achieve with acupuncture is to get your periods regular, and we're going to do that through improving blood flow to your pelvis and to your reproductive organs. But obviously, if your periods are irregular, it's going to take us a couple of cycles to get there. As I've already mentioned, acupuncture helps improve egg and sperm quality, and it takes about 3 months, I think it's between 90 and 100 days, for an egg or a sperm to reach full maturation. So again, it's important, if you want to get the best out of acupuncture, is to start 2 or 3 months in advance. But if you're watching this video and you're starting your IVF in 2 weeks, don't worry, anything you can do now will still help. So what happens at your first consultation? I can see you by yourself, or I can see you with your partner. Either is absolutely fine with me. And at that first consultation will take a good amount of time for me to get your full medical history. I want to understand as much about you and your life as possible. I will specifically ask you about any fertility tests you've had done. So if you've got any blood test results, if you've had a high COSI, if you've had an ultrasound, all of that information will be very useful. But I'm also really interested to find out about your lifestyle, because lifestyle infertility is massively important. And if you've been labelled as having unexplained infertility, it may be a lifestyle factor that is affecting your fertility. So I shall ask you about how much exercise you have, about your diet, any food preferences, for example, if you're vegetarian or if you don't eat very much meat. All of those kinds of things will help me make a very good picture of you and your health. I will also obviously ask you about your periods, about whether they're regular or irregular, any premenstrual symptoms, and about your contraceptive history. Everything's fine, and I would ask absolutely, whatever it is, is normal for you in your life, it is really important to kind of come clean, because that's really helpful, because there might be some very simple things that we can affect that will help you. How many treatments you need really depends on your personal circumstances. Every case is different. So if all your blood tests and all your fertility tests are all normal and you have a super healthy lifestyle and your periods are regular, then probably I wouldn't need to see you as often. If you suffer from polycystic ovary syndrome and you haven't had a period for 6 months or a year, then obviously there's more to do and I might need to see you more frequently. And I think realistically with polycystic ovaries, unless you're very lucky, you'd probably need to come for acupuncture for a minimum of 6 months. But for women's fertility issues, I like to see all patients weekly just through the first cycle, because I want to see exactly what's happening in your body at each stage in the cycle. And then where we go from there depends really on what's happening with you. So for example, if you're ovulating late, then we might decide after that first month that actually that I'll see you just before ovulation to help promote ovulation. If you're suffering a lot of premenstrual symptoms, I might say, well, I'll then see you monthly just before your period is due. If you're having IVF, it's a good idea to start your acupuncture quite early. That way we can iron out any issues, any period irregularities or hormonal irregularities as soon as possible. Typically what will happen once you start your IVF is that I would see you weekly throughout each phase, and then I would see you on the day of egg collection, both before and after egg collection, and again on the day of embryo transfer, before and after transfer. A major review of more than 3,000 women in 12 IVF studies actually showed that having acupuncture on the day of egg collection and on the day of transfer makes a significant difference to the increased success rates of IVF. The studies also suggested that acupuncture for IVF is dose dependent. So actually the more treatment that you have, the women who had more treatment actually fared better in IVF than those who had fewer treatments. So what can you do to help your fertility? Lifestyle is hugely important, and there's lots and lots you can do in terms of addressing your diet, getting lots of exercise, eating really well. It's a good idea to take a good quality fertility supplement, and in addition I would probably take some omega-3 fish oils. If you have polycystic ovaries, actually you might want to consult a nutritionist because diet is particularly important. It's also really important to remove perfume and toxic chemicals from your beauty regime and from your cleaning cupboard. They can have a very profound effect on your fertility. Also, it's really important to reduce your exposure to electromagnetic radiation from mobile devices and from the modem or router in your house. It's particularly important for men. It's been shown that men having their mobile phone in their back pocket significantly affects their fertility and their sperm count. But for women as well, electromagnetic radiation actually is quite damaging. So take your mobile phone out of your bedroom and charge it in the kitchen. Changing your lifestyle is massively important. There's lots you can do and there's lots of help out there. There are some really good self-help books. There are some lovely ones written by an acupuncturist called Emma Cannon, and they're really practical. They're very easy. They're not patronizing. As a starting point, you could take a look at a blog on my website. Over the years, I've treated lots and lots of couples for fertility acupuncture, and I'm very happy that they've had lots of very happy and healthy babies, which is great news. I'm very happy to chat to you if you've got concerns about this. If you want to hear other people's stories, take a look at the reviews on my website. There are quite a few. Anyway, good luck.